Admission and discharge procedure, right? So yesterday we completed admission procedure. So can anybody tell me the types of admission procedure? Can anybody tell me the types of admission procedure that we have discussed yesterday? Forgot? Okay, so the types of admission procedure are, there are three types, okay? That is emergency admission, routine admission, and transfer. Okay, so there are three types of admission procedure. So next, today we will discuss about discharge procedure. So I will start sharing my slides now. If you have problems seeing, please stop me in the middle, or if you don't understand any point, then you can stop me in the middle, okay? Can you see everybody? Can you see the slides?
Yes, ma'am.
Okay.
Yes, ma'am.
So today we will discuss about discharge procedure. Can anybody tell me what is discharge? What is the meaning of discharge?
Ma'am, when the patient taking proper treatment and proper investigation after recovery from the disease and after recovery from any kind of the abnormalities in our body, then the doctors give discharge paper, मैम मतलब वो बाहर जाता है ना discharge होता है मतलब
Yes, very
after
good.
recovery.
After you have done your admission procedure in the hospital, after you have been admitted for any disease condition or any surgery, after that you have completed your treatment, then the doctor will allow you to go home from the hospital. That is simply called discharge, okay? So discharge occurs when a patient leaves the hospital after a period of treatment to his or her home. It normally done at the discretion of the medical team when patient is fit for his condition and is stable, or upon patient's own request. So sometimes discharge can be not only from the doctor side, on the patient request also, we sometimes give discharge to the patient, okay? So it is important that patients and relatives have a prior knowledge of the intended discharge. So without giving any prior knowledge to the patient or the relative, we cannot give discharge. We have to explain to the patient why we are giving discharge, about the treatment, that this treatment is done. Now you can go to home and you can continue your further treatment from home itself. So we'll have to give a proper knowledge and prior information to the patient and patient party before discharge. Coming to the types of discharge, cured and discharge. We all know this type, right? Cured and discharge. As I have already explained, patient came to the hospital due to any problem, got treatment. Now patient is fine and can go home and continue, if there is any treatment left, and continue the further treatment from home. That is cured and discharged, okay? Patient completes the initial or actual management in the hospital, and now he or she need not to be under direct supervision of that hospital. Okay, they don't need to be under direct supervision of the doctor or of the hospital. So that is cured and discharged. The next is LAMA, that is leave against medical advice. Okay, a client can decide to leave the hospital against medical advice. For this, client must sign a form that releases the physician and the healthcare institution from any legal responsibility for his or her health status. The client is informed of any possible risk before signing the form. Okay, now coming to leave against medical advice. As I have already said, sometimes some discharges are not only dependent on the doctors, right? Sometimes it depends on the patient also. For example, suppose a patient is admitted in a Tata Medical Hospital due to any cancer-related problem, okay? and the patient has to stay in the hospital for a longer period of time. But that cost, the more you stay in the hospital, the more of hospital cost increases, okay? And that patient cannot bear the cost anymore, even though he has to get treatment from the hospital. So he and his family members plan that they will leave the hospital even though it is risky for his health. Okay, so they will consult with the doctor that I don't want to continue the treatment anymore in the hospital because I cannot foot the bill anymore. I cannot stay in the hospital anymore as the patient is having some kind of financial problems. So in that case, what happens is the patient can leave the hospital, and as that is against the treatment, the original treatment modality and against the advice of the doctor, so that is why it is called as leave against medical advice. Okay. So now what will happen if we just leave the patient from the hospital without giving proper treatment? The patient might have some risks at at home, some complications. The patient might develop some complications. Now, if we do not take any undertaking or any responsibility from the patient, what will happen? The patient may come back to the hospital and might sue the hospital that why did you leave the patient if you know that the patient will be at risk. So for that is why we need the patient to write a form that yes, it is against the medical advice. I know these are the risks I will be having after I leave the hospital, after I discontinue my treatment, and I am fully responsible for all the complications. The hospital and the doctor in charge will not bear any charges. Okay, so this form has to be filled up by the patient and the patient party, then only they can leave the hospital against the medical advice. Okay, understood? Next is discharged
Yes,
on
ma'am.
request. Now there's a difference. This is also same. Okay, the patient will request the doctor to discharge, but there is a difference between LAMA and discharge on request. In LAMA, if the patient leaves the hospital against medical advice, there is a possibility of developing risk or complication at home. However, in discharge on request, even though the patient is requesting to be discharged from the hospital, there might not be any possible risks. Okay, that means the treatment is almost about to be completed. The patient is almost cured or about or is stable, and the patient wants to go home. So on these cases, it is called discharged on request. Okay, let's see. It would mean that the patient requested to be discharged and the doctor discharged him. Here, the doctor does not commit any illegality. As a matter of fact, very often patients are routinely discharged on request, and mostly such discharges are not against medical advice. Now, for example, a patient came to a hospital in surgery ward. The patient got admitted in surgery ward due to surgery of gallbladder stones. Now, gallbladder stones is not a the surgery for gallbladder stones, it is not a very big procedure. Okay, after 2 days or 3 days of surgery, the patient is fine. The patient can walk on his own. Patient can eat food. Okay, but the doctor was planning to discharge like after 2 days. Okay, the doctor wants to observe, but the patient wants to go home. Now his treatment is completed. Okay, the patient is fine, the patient is stable. So the patient requested the doctor that please discharge me as I am fine now and I can continue my treatment at home. The doctor will see if there is any risk for the patient to send home. If there is no risk, and if the doctor thinks that yes, the patient can go home, even though we discharge the patient 2 days earlier, then the patient can discharge the doctor can discharge the patient. Okay, so that is called discharged on request. Did you all understand the difference between LAMA and discharge on request?
Yes, ma'am. Yes.
Okay.
Yeah.
Now next is absconded. So I think everybody know the literal meaning of absconded means ran away, escaped. Okay, so that is what absconded means, escape. Absence without leave, absconding or elopement. Okay, the patient has eloped without informing any hospital authority. That is called absconded. Okay, so escape, whereby the patient leaves the hospital without notification by escaping from an involuntary unit or walking out of a voluntary unit, also has been considered from some clinicians and researchers to be a form of discharge against medical advice. Now a patient was in a hospital getting treatment. Okay, if once the patient comes in the hospital, if a patient comes in the hospital, the patient has to follow some rules and regulations of the hospital, not for the safekeeping of the patient as well as for the hospital, right? So now a patient came to the hospital, so the hospital authority is liable to know where the patient is, what the patient is doing inside the hospital. Okay. Now the patient, without informing the hospital authority as well as the doctor in charge, has left on his own and there was no information. So okay, in those type that is called absconded, and later it will be converted into llama. This is also a type of llama. Okay. Next is referrals. Okay, referrals means the act of sending of a patient to another physician for ongoing management. Okay, now I'll give the same example as of yesterday. Mr. X, he got admitted in medicine ward with the treatment for the diagnosis of severe pneumonia, right? Now the physician from the medicine ward, after investigation, found out that the patient is also having some surgical problems. So after he treat the patient in medicine ward, he will refer the patient to the surgery ward, to the doctor in charge. So once the doctor in charge from the surgery ward plans to take the patient from medicine ward, then this doctor will give discharge. Okay, that is called referral. From means refer from one department or one ward to another department or another ward. Okay, understood? Next is death. So we all know that, right? Once the patient died in the hospital, that will also be a type of discharge. Okay, understood everybody, the types of discharge? So what are the types of discharge? First one is cured and discharged, leave against medical advice or llama. Next is discharged on request, then absconded, next referrals, and then death. Clear everybody?
Ma'am, referrals also under discharge, one type of discharge, referrals.
What referrals? Yes,
Yes, ma'am.
referrals is also one type of discharge, because if you refer from one department to another department, the department in which the patient was showing previously, that doctor has to discharge from that department. Okay, like I have given the example for Mr. X, he was first doing his treatment in medicine ward, right? After he completed his uh, his treatment in medicine ward, he will go to surgery ward. Now if he goes to surgery ward, the medicine doctor has to first give discharge from the